Hey everybody, this is Doreen at Pave, Parent to Parent with our Pierce County support programs. Today we're working on a video because we've had a lot of requests through Family to Family and our support programs here about how to apply for DDA eligibility. I noticed there's a lot of resources online for this through Informing Families and the various ARC programs. But I kind of wanted to just walk you guys through how to find the paperwork and a few tips about things you want to include. So today you're just going to pull up your regular search bar. You can use Google or Yahoo or whatever and type in Developmental Disabilities Administration, Washington. Okay. You're going to come up with search results. I'll show you what Google brings up. And here's the Developmental Disabilities Administration, DDA. DSHS. So you can tell this is for Washington because it's .wa.gov right here. And we're going to click on the eligibility link. A lot of times parents find this stuff very complicated and hard to understand. So they've been working really hard at the state to make this as accessible as possible for families in Washington. And the main three forms that you need to print from here are the request for DDA eligibility determination, which is going to pull up here quickly. You can download this in a number of different languages. I'm going to pull up the PDF version so you guys can see it. And this is basically their form to request an eligibility determination from the state to see if you will qualify for waiver services or community first choice personal care services for your child or for an adult with an intellectual or developmental disability. So you're going to see this form is pretty basic. It's looking for demographic information. Where it says applicant information, that is the person with the disability. So if it's a child, you're still going to put your child's information in here. Obviously, for younger kids, they've never been married, and you want to know what basic information that they need for communication and support. You're going to fill out why you're applying for services. Usually that's because you're looking for some type of support. You're looking for respite care for parents to get a break, or you're looking for personal care services for someone to come in home and help your loved one or your child with services and support in your home. Or you're looking for recreational programs, so the Individual and Family Services Program. They're going to lay out a few of the different disabilities here for you. And they are going to ask if you've applied for Social Security income or benefits here and get information from that. Down here below, you're going to put your information as the representative or person helping fill out this form. So this is where the parent contact information will go. So that's the first form. The second form that's really important for a DDA application is going to be their consent form. So the consent form for DSHS is 14-012. They all have their own numbers and they're constantly updated. So if you're needing to apply again, it's really best to go online and print those forms or to call your DDA office and ask them to send you a new eligibility packet. Even if you've applied in the past, the rules change. And so it's important to just reapply every so often to see if that eligibility rule has changed in any way or if your child's condition has changed based on their documentation or reports. If you have a new diagnosis. This consent form is pretty straightforward. Again, you're putting the individual with the disability's name here at the top under client identification. You're going to check the boxes where you're releasing consent, and that for healthcare providers, you want to put the larger conglomerate. So if it's Multicare, if it's University of Washington Medical Systems, if it's Shriners Hospital, you want to put the larger name there so that they can get all the records from all the specialists within that healthcare agency, or Seattle Children's Hospital. Again, you're going to try and give them release to get records from anywhere that has testing or diagnostic information. So usually the primary places that have that information are Social Security, Employment Security, other DSHS providers, school districts or colleges, and then your healthcare and mental health care providers. They're going to have basic diagnosis information and any kind of adaptive tools that have been done. They're going to be a part of those records. Something I also include in here under other is early intervention providers. So a lot of times if they're looking for information from a very young time, you want to include those people. I usually tell them all my client records so that they can get whatever records that they need. And then also if you have to release mental health, HIV, AIDS, or STD, or chemical dependencies, those are special, so you have to click those boxes separately. You can put how long it's valid for, and then the signature or sign of the individual, and also the signature of the parent or other representative. If you're supporting a person over the age of 18, you need to show proof of why you're signing on their behalf, or they need to make their own signature or mark on this form. So that's the consent form. And then the third form that's really important for applying for disability services in Washington State is the HIPAA privacy policies. You have to acknowledge that you have seen the privacy policies that DSHS uses for how they handle protected health information. For an individual with disability, just being a part of that administration is protected health information. So you just want to pull up this privacy practices form and sign that you've received it. That's the main purpose of this form here, is that it's wanting to know that we received the form, we understand that you're going to protect our health information, and we did receive that form as part of our eligibility process. You can call any of your regional offices at any time to get this packet mailed to you if you'd like to fill it out within their packet form. And usually that comes with a no-cost stamp envelopes that you can send the information back. So here's that consent form. Again, you're going to have the client, which is the individual with disabilities, name and date of birth, and then the representative signature or the client themselves signature here when you're applying for developmental disability services. The other form that I want to show you guys talks about the different eligibility conditions and the different ages that those conditions pull up under. So as you know, the Developmental Disabilities Administration serves a particular population of people. They have IQ limits, and they also have specific criteria for each diagnosis as it comes up. What I think a lot of people don't know is that a person, particularly a child, can be eligible for Developmental Disabilities Administration services up until the age 10 under the condition of developmental delay. So a lot of people leave birth to 3 services and let their developmental disabilities services go away after birth to 3 at age 4 because they don't really understand that their child could continue to get service or get additional services after age 3 from the Developmental Disabilities Administration. So they have a form here that talks about the eligible conditions specific to age. DDA does eligibility review at 3 different sections. So 3 different times in life. So they do an eligibility review at age 4, as it shows on this chart. They do another one at age 10 and one right before the 18th birthday. And so you can see that the conditions you can be eligible for up to age 10 include developmental delays. There's a medically intensive program for kids who have really high medical needs, like with a trach care and those kind of things. And then starting at age 4 all the way up until adulthood, there's intellectual disabilities, cerebral palsy, epilepsy, autism, other neurological condition, or other conditions similar to intellectual disability. So there is some freedom in these, and it's important to know that you could be considered differently at different times based on your cognitive test. So that's an IQ test. And those can be done by doctors in a neuropsychological evaluation. Or they can be done at your school by the school psychologist. So it's important to know that this type of testing is available, particularly to school-age students through the school evaluation process, and that the adaptive assessments can be a part of that. So these are the type of tests that DDA accepts. So that's kind of an important thing. If you're having an assessment done and they're not doing a cognitive or adaptive test that's accepted by DDA, that's going to impact your eligibility. So this is an important thing to look at, and you want to gather information from your doctors and from your school and pull all that together and turn it in with your application to see if they can make your child or the individual you're supporting with an intellectual or developmental disability eligible with the documentation that you have. If not, they'll use that consent form to get additional information. I can't tell you enough how willing the staff in the eligibility departments are to help families access DDA. So if you go in or you call to make an appointment with one of them, they'll help you in the office, and they can request interpreters or other supports. And there's DDA offices all over the state. There's 3 regions. It's broken up into 3 sections. Region 1 covers pretty much everything east of the mountains, and you can see there's 2 kind of main offices. Region 2 kind of covers everything from King County north on the west side of the mountains, and then Region 3 covers everything from Pierce County south and west. So that is pretty much the way that you can reach each of these places. There's an email and a phone number for each office here that's toll free. And they also have some frequently asked questions down here that you can look into that give you RCW and law about what the disability conditions are and why or how that's defined. So I hope this is helpful for you as parents. I know for me, this is a thing that seems to confuse a lot of people. And I just want you guys to know that the services that are out there from the state Department of Social and Health Services are really there to help and support you as much as possible. Again, your kids can be eligible under that developmental delay until age 10, and that's a big deal because you can get needed services and supports. I hope this was helpful to all of you, and have a wonderful day. Thanks so much. Bye.